Hi, I'm Isabella VanZyl. This is my ID and learning. Today I'm going to start with hand washing. I'm going to grab a paper towel to open the faucet. I'm going to test it to make sure it's okay for me. I'm going to make sure not to flick or sling water anywhere. I'm going to make sure anything on my wrist is at least 2 inches above. And I'm going to wet my hands at least 2 inches above my wrist. Now I'm going to get some antibacterial soap and lather my hands with it. I'm going to start scrubbing my hands on the back of my hands between my fingers and making sure I get in under my nails by scratching my palm. I'm going to do this for at least 20 seconds, and then I'm going to rinse with the water, making sure not to touch the inside of the sink or else I will have to start over. I'm going to dry my hands now. I'm going to throw that away. I'm going to grab another paper towel to turn off the faucet. And now I'm going to go get my PPE together. First, I'm going to put on my gown. I'm going to hold it in front of me and let it unfold, making sure not to fling it. I'm going to tie my neck first. And then I'm going to tie behind my back, and I'm going to fold it so that it covers all of my clothing. Next, I'm going to put on my mask, but since I already have my mask on, I'm just going to demonstrate what I would do. Instead of touching the mask itself, I'm going to grab the strings, make sure it's the right way around, put it over my ears. I'm going to pull it up over my nose and pinch my nose and make sure it's covering my entire face. Then I'm going to put my goggles on. And then I'm going to put my gloves on. And when I put them on, I'm going to make sure it's going over the cuffs of my gown for infection reasons and contamination reasons. Now I'm going to go introduce myself to my patient. Hi, I'm Isabella. I'm going to be your CNA for today. Are you Miss Donahue?
Yes.
Do you mind if I check your wristband? Thank you. I'm just going to go gather my equipment and I'll be right back. I'm going to provide for privacy and check the wheel locks on the bed. I'm going to go grab my wheelchair and put it where I need in the room. And I'm going to grab my gait belt. Usually I would wash my hands, but since I already did before my PPE, I don't have to do it again. All right, I'm going to go ahead and raise your bed if that's okay. And I'm going to sit you up. Feel free to adjust yourself if you're uncomfortable. All right, I'm going to go ahead and fold your linen down. Sorry. Making sure this doesn't touch the floor. I'm gonna go ahead and put the rail down. All right, I'm gonna help you turn over. We're gonna sit on the side of the bed. Your feet might be dangling and we'll adjust that whenever we get to it, okay? I'm gonna go ahead and help you. 1, 2, 3. All right, are you feeling dizzy? No? All right. I'm gonna go ahead and lower the bed so that your feet will be flat on the floor so it'll be easy for you to stand up. Can you scoot forward a little bit? All right, are your feet on the floor? I'm gonna make sure you have your robe on, and I'm going to put your slippers on. Since she has left side weakness, I'm going to help her put her foot inside of her left one. All right, I'm going to pull this wheelchair forward. Make sure it's parallel with the bed and lock the wheels. Making sure there's enough room for her to get in. All right, I'm gonna go ahead and put this gate belt on. Here we go, if you could. I'm gonna make sure there's enough room for 3 fingers so that I'll be able to keep her comfortable and help her. Can you can you push off on the bed whenever I count to 3? All right, I'm gonna help you. 1, 2, 3. Are you feeling okay? All right, we're gonna pivot towards the wheelchair. All right, back up until you feel that wheelchair against your legs. Let me know when you feel it.
Okay.
All right, go ahead and put your hand on the armrest, and I'm gonna help you sit down on 3. 1, 2, 3. All right, I'm gonna go ahead and take this gate belt off. Are you comfortable? I'm gonna go ahead and fold these. You can go ahead and put your right foot up here, and I'm gonna help you with your left foot. I would unlock the wheels, and I would go for a stroll and leave her where I needed to. Then I would take off my PPE properly, wash my hands, report, and record.